I knew that we were the type of practice we want to be here for our patients. If a patient is sick, we will see them that day. That's been my motto from day one. If you are sick that day and you contact us, we will see you. With that motto in mind, I knew that efficiency and speed, as well as proper documentation, was the most important thing that we needed in our offices. And the paper record, I had written and designed probably about 4 or 5 different designs of medical records in order to have speed and efficiency present, because dictating notes, it would take too long to get dictations back, and in pediatrics, mother called next day, I spilled my medicine or kid's not better. I needed to know instantly on my records what happened yesterday. So I could never go to dictations and get them back in time and on my charts. And so after doing that, I was just really frustrated, saying, you know, with the onslaught of technology and the information age, why is it that physicians are not using the computer? And this was back in the 80s. So in 1988, I started building a computer with my plans to write my own design. And that's when Windows first came out. It wasn't even called Windows. It was called some number 88 something. And so I was there when they first came out with a graphic version of Windows, and Apple was just out and on computers. And I was looking how to do this. I wasn't a programmer, but my wife was, and I was trying to talk her into helping make a program. And we realized that it required so much time. I was looking for proper documentation and efficiency of ease of operation and me moving around seeing patients on a rapid basis, because I was seeing at that time 70 plus patients a day on average. And there's no way I could slow down that process, and I didn't want a computer to slow me down, but I wanted to capture more information than I was getting on my medical record, because I knew that I wasn't getting my problem list updated and a lot of things that I felt was needed to have better continuity of care.
Yeah, the practice I worked with before was paper-based, and it was horrid. I really like the electronic medical records because it's a lot faster. And I can get in and see a patient a whole lot faster and get it all recorded a whole lot faster than I could on a paper chart.
The medical record system that we use is very important in my job position because it helps us with the patient flow. I can see what the doctor is doing in the room at the same time that the doctor is viewing it. The nurse can also know which shots and which labs are ordered, so that we can make the experience a faster experience for the patients, and it makes it, billing can also see it at the same time. So if we had any information that was missing in our chart, we could correct that immediately.
In September 1995, contrary to all the naysayers that exist in this country, Dalton, Georgia, there was a physician seeing patients, walking room to room with a handheld pad wirelessly, making my notations, printing out my original pharmacy prescriptions, and even fax them to the doctor's office.
Because it is efficient. It is efficient. Your records are, you know, if somebody wants to access it and you want to, you know, send records, they're all there, and it's all nice and neat. You don't have to try to figure out somebody's handwriting. You don't have to try to, you know, look through other things. It's all right there. And it's very efficient.
It allows you to meet the needs of the patient. It allows you also to meet the needs of the insurance companies. These patients, or the practice, as far as going from paper, initially it's overwhelming. And just to bear that in mind, it comes with some time. You're learning constantly, and after a while it all comes together, and it makes it so much more efficient, and you can get so much more information and have a better continuity of care for the patients.
And what happens, and just in a nutshell, is that the efficiency to get a patient checked in and moved back to my nursing staff and to be placed in the room and see me, what transpired was the patient's time spent at the front or the front desk was cut short, but the patient's time spent with medical personnel was increased. The people spent more time with nurses and more time with doctors, and that has a major effect upon a person's outlook about how they're being cared for.
My background is medical record administrator. I also very compassionate person. You can see more patients, you can touch more lives, and this allows us to do that. It allows me to have more contact with the patients because I'm on the floor with them, instead of being back in my office looking at papers, and so it gives you more of a personal contact with the patients.
And we were faxing prescriptions to the doctor's office in 1995. And I've heard consultants saying to people in 2000 that no such thing existed in America. And I had been doing it for 5 years. People from all over the United States were flying to Little Dawson, Georgia to see this practice doing that. And I was still seeing my 60 or 70 patients a day and finishing on time now with all the documentation in the world and a much better prescription, legible prescriptions that can be read, no errors in them, and we always had the original on file. It was an awesome setup.
In projection for the future, it will make it easier for us prescriptions. You'll be able to do that over line. We can call them directly at home to confirm for appointments if we needed some extra information from them, and also their home computer, eventually they can look online with a web portal with their own password and can see information in their chart. So it will be a great advantage for.
Well, there's a lot of people like us and other groups that have done this for up to 10 years, and the best bet is to contact someone like us, or even us, because really you can't just try and do this on your own. You really need to ask someone who has done it, because this is not new. This has been going on for 15 years, so there are people who know what they're doing. Your best bet is to consult instead of just trying to do it on your own.
And also, you know, there's different EMR companies, and you have to look at more than just one. You have to look at different ones and see what they offer, because some of them have different IT teams other than themselves to come in and help you. And if you can talk with them, and you'll see which one is going to work for you.
With his passion with the medical records, he's very passionate with electronic. He wants to be on that top edge where we can serve our patients not only in their physical health, their mental, spiritual, their well-being, and to make it all work together. And it's in fact all of us, from the upper down to the manager to the employees and to the patients.
As a matter of fact, the DEA of Georgia came to my practice. The main man of the state came to my practice, looked at it, and said, can we sell this to every doctor in the state? Because this is the best program we've ever seen in our lives, and the way that it tracked the pharmaceutical records. And he wrote a letter to all the pharmacists in the state of Georgia and told them to accept my prescriptions. Because back then, pharmacists were told not to take electronic prescriptions from doctors' offices. And he wrote a letter and gave me his number and said, any pharmacist who would not accept my prescription, you give them my name and number and have them call me. And if they won't call me, you call me, and I will rectify the situation. So this is how we start off in '85, and we have not slowed down since. It's been a tremendous impact upon my life, the patients' lives, and this practice.